with Dr. Dana. Dr. Dana, good afternoon.
Hi, how are you?
Fabulous today. Thanks. I hear you're in Florida, Dr. Dana.
Yes, I'm glad I'm avoiding what you guys are going through.
So go ahead and taunt us a little bit. What is it like down there?
It's 75, and it's raining now, but it was sunny earlier.
Oh.
Wow.
Well,
75.
Maybe later you go out and shovel some sand for us just to empathize. Dr. Dana, what are we talking about today?
Today on Health Matters, I thought it was very relevant that we talk a little bit about congenital heart defects. January was Birth Defects Prevention Month, but there's a very important week, the second week in February, this Congenital Heart Defect Awareness Week. And we know that congenital heart diseases are the most common birth defects and a leading cause of birth defect-related deaths worldwide. And congenital heart defects affects approximately 1.8 million of our families within the United States. And we need a week like this for awareness to emphasize the need for research, treatment, and parent support.
1.8 million families are affected?
1.8 million families.
Wow.
That's U.S. now.
Wow.
Okay. One of the congenital heart defects that I chose to talk about today goes along with a couple of families that you, Gina and Mike and myself are very familiar with, and that is the Hypoplastic Left Heart Syndrome.
Mm-hmm. Yes.
This is a rare and a complex heart defect whereby the left side of the heart is critically underdeveloped, and thus adequate oxygen-rich blood cannot be pumped, out to the body. Now, normally, our right side of our hearts pump blue blood or oxygen-poor blood over to the lungs. We get oxygen there, and then the left side of the heart pumps it out to the oxygen-rich blood out to the body. These newborns with HLHS usually show the following symptoms, though. They are grayish blue skin-colored babies early on, and they have respiratory distress with rapid breathing. They're babies that are just poor feeders. They just don't want to eat because they don't have the energy. They're listless and drowsy. And there's a predominance in males that we know versus females with about a 55 to 70% male predominance. Now, part of the problem in the past was that it was diagnosis, okay? But because of prenatal ultrasounds, we can get to these babies early on. Prenatal diagnostic abilities have just helped so much. It allows us to do this ultrasound. The ultrasonographer, the person reading the study, can make the diagnosis and then refer these moms to centers to deliver their babies where they have the proper people on hand to take care of this baby following delivery.
Right.
Yeah, I've actually read and talked with my friend Colleen, who we mentioned, who will be on our show Saturday, talking about her son with this, that they have been able to do some surgeries while the baby is still in utero.
That's very true, and that's what has been the beauty of these prenatal diagnostic studies. It's very important. I urge your listeners out there, moms who are pregnant, because almost across the board, moms are having ultrasounds done. You go ahead and ask the questions. You step out and ask your doctor about the organs, the important organs. How were they on the ultrasound? Okay, don't let something go unnoticed. Ask them. Yes, the heart was fine, the brain was fine, but here we're talking about hearts, because they can diagnose these problems. If there's procedures that need to be done intrauterine, they can, but certainly they can be prepared when the baby's delivered.
Dr. Dana, is there any idea what causes this?
No, that's one of the problems. We don't know the cause directly. That's what the research is about. But with that said, we do know that the risk goes up in those families where there has been a baby born with the Hypoplastic Left Heart Syndrome. If these babies are subsequently delivered and not diagnosed, let's say that somehow mom does get through her pregnancy without an ultrasound, then babies will get sick sometime after birth between 48 and 72 hours. This used to be the nightmare for the pediatricians, because these babies actually sometimes will get out of the newborn nursery and home and then subsequently get sick. But the life-saving fetal circulation kept them well for about 48 hours, so that once that closes off, which it normally should, then they were not getting any oxygen-rich blood out to the body.
There's another issue regarding these babies. When they do these ultrasounds and they find something's wrong with the heart, my friend and I have discussed this many times. There are different sort of, I guess, levels of education out there in the medical field, and some doctors' offices will suggest to moms that they maybe terminate the pregnancy, maybe because they don't have the information that these babies can live and thrive and have wonderful lives.
Oh, absolutely.
And it's
I talked to Colleen last night, or I should say we text back and forth, but you and I both know Tommy and the beauty of that young man. He's 10 years old now, and there's no reason to even take on that consideration. That's why it's so important to get to those pediatric centers where they're doing this high-tech cardiac surgery.
And certainly,
because quite honestly, they're not doing it everywhere, which they can't. So you need to seek out. We know it in our area of Southeast Michigan, CS Mott Children's Hospital have just some unbelievable surgeons as well as cardiologists. And that's the type of referral that I'm talking about.
Right. We are blessed that we are close by to those facilities. So, Dr. Dana, thank you for shedding a little bit of clinical light on that very human experience. And the lady who keeps coming up in conversation, Colleen Shoemaker, is actually a director of Hearts of Hope, a terrific foundation organization here in Southeast Michigan, and she's going to be joining us this Saturday on Your Family Matters.
That's wonderful, because you're going to get a wonderful feedback on this defect and the road that Colleen and Mike and her kids, her family, have followed through this. The other, I just want to mention real quick. Mm-hmm. There's also another website, tchin.org. The Congenital Heart Information Network. I just think your listeners should be aware of that. So, because there may be some other heart defect that they're involved with, and this is an area where they can get a website where they can get information.
Thanks so much. Dr. Dana, as always, enjoy the Florida weather, and we will be speaking again in a couple of days, Saturday morning.
Okay. Thank you so much, and I will definitely be praying for a safe journey home for you guys tonight.
Thanks. Bye now.
Thank you.